Welcome to the Death Before Decay podcast. I'm Dr. Elliot Humiston. The show is about confidence, craft, and building something real in dentistry, in business, and in life. This season is brought to you by Taylor Drive Dental Care. Today, I'm sitting down with Dr. Ethan Just. He's a local orthodontist here in Sheboygan. Fourth-generation dentist.
Yes.
Third-generation orthodontist.
Yes.
And you're someone who's building your own name in this community. Today we're going to talk about legacy, about how ortho and dentists get along and what we do together, and what it actually takes to build something of your own from something that was built by your predecessor.
Right. That's something that we both know quite well.
Yes, we do. So let's get some background on you, man. Why the hell did you become an orthodontist?
So, pretty long story. I was really into sports growing up, more action sports. I was really into skiing.
Yeah, you were in the X Games, right?
I competed at the X Games course, but
I'm going to say that you were in the X Games because it makes it cooler.
Yeah, right. So I was really into skiing growing up, and I really liked the individual sports where you could push yourself. I really liked setting goals for myself, and skiing was something that I just found really interesting, and it's something that you could really push yourself and grow every year. So I was skiing a lot during kind of my middle school, high school years, and then I also played football. And
you played football?
Yeah.
Okay, cool.
I was a running back for Manitowoc.
Right on.
Yeah. I loved all of that. And going into college, I was going to play football for University of St. Thomas. I did have a little bit of a knee injury, so didn't really want to play, wanted to more focus on school and, the future of what I could do in academics. So from that point forward, I just kind of shifted my focus from, the athletics into more of education and all that stuff. So growing up and seeing, my dad's in orthodontics, my grandpa was an orthodontist, and great-grandpa was a dentist. There's a lot of dentistry in my family, and I really liked science. So those things kind of meshed together really good. So in undergrad, I just kind of really dove deep into the science, biology, chemistry, and just kind of found that dentistry could be something really great for me. And it was really fascinating. And the more that I got into the sciences, the more I found that dentistry was the route that I wanted to go. And again,
so it wasn't always the plan for you?
Not at all, no.
Really? Okay.
But it was more of just kind of another way to push myself.
Sure.
I wouldn't say that I was a stellar student in high school, but I was okay. But, it's like in high school you have a lot of distractions. Like I was playing all these sports where in college you just kind of focus more on your studies. And so that was where I was able to push myself and see what I was able to do. And then just applying to dental school, getting in. And, I actually went to California for dental school, which they have some good skiing out there too. So it was actually a big positive. But that's
why I went to college out west, and then I skied too much and didn't go to class.
Yeah, you got to try to limit those things. Yeah. It's out there, but it's like you got to focus on your schooling. But so I didn't get to ski too much in dental school, but I think in dental school was where I really excelled because you're studying things that you're interested in. Yeah. So it's combining the dentistry aspect with the science background that I already had. So that was really fascinating. And then probably around my second or third year of dental school, that was when I really realized how orthodontics plays into the dental world.
You were straightening a paper clip one day, and you're like, "Hey,
that was it." That would have changed my mind.
That is a real exercise in dental school. Right. Is you straighten a paper clip. Did you guys have to do that?
No, we didn't. That would have turned me off right away.
We had to do that. We had to straighten a paper clip and put it on a desk.
Right.
And if it rolled like oddly, they took points off.
It's hard.
Yeah.
Yeah, I've done it before. But it's tough. I started to see the impact that occlusion can have kind of on the overall health of the mouth.
What's occlusion?
Occlusion is how the teeth are biting together for long term, right? So I guess growing up, I saw, the crazy transformations between, before and after photos with orthodontic treatment, but I didn't really understand how important it can be to the whole mouth.
Yeah.
And that's really what you start learning in dental school, is how everything fits together. And that was when it really clicked for me. Like, orthodontics, it's not just about straightening teeth. It's more about building the foundation to have healthy teeth for the whole life. So that was what was really intriguing to me. And I think once I saw that, once I had that moment, then that was like, this is what I want to do. My dad's already in it, and I can learn from him. And
Sure.
It's just been, it's been really great working with him for this whole time. So
if you get braces once, does that mean the work is done, or is there sometimes multiple phases?
Well, it kind of depends. I would say nowadays we're focusing more on being proactive about orthodontic
Yeah, I would
treatment.
agree.
So, treating kids younger can help encourage the permanent teeth to come in relatively where they should. And then that can help be a more stable position for them the long term, because if we wait for all the permanent teeth to come in, then we have to force them to go into the correct position, and that's where we start seeing these relapses. So treating kids early, very, very malleable at that age, and there's really not much that we can't accomplish if we see kids earlier enough. So I think that's kind of the route that orthodontics is going, is being more proactive than waiting.
I think you're cutting your like cutting yourself a little short here, because I don't think enough orthodontists think of it that way right now. Like, I think we're really lucky in this community to have you and one of the other orthodontists that do care about that, like, deeply.
Right.
The two-stage orthodontic approach is really important to me. It's why I'm we have 5-year-olds, 6-year-olds in the chair that were like, hey, just go get the evaluation. Like, I'm trained enough to like identify when things are real bad.
Right.
But he's trained from a developmental biology aspect to identify, hey, where's the cascade effect happening? Is that
Right.
what you're like, and that's what you're focused on, right?
Right. And especially looking, when we take x-rays at a younger age, we can help predict how they're going to grow. And that's what my master's thesis was on, is craniofacial growth and development
Right.
of younger kids. So then we can help predict how they're going to grow. And then we can really get on top of some of these problems that we see arise that are sometimes only fixable at a younger age. And if it goes untreated, then it becomes more of a surgical case down the road.
100%. One thing that's I think is interesting, and maybe you can like hit on this. Like, we have a lot of parallels. Like, my dad's a dentist. My dad worked with your grandfather and your father
Right.
back in the day, because he used to practice up in Manitowoc. But we're not practicing dentistry or orthodontics the same as our parents.
Right.
You're more focused on airway. I'm more focused on rehabilitation. But like, the one thing that I noticed early on is I had a lot of adults with these narrow palates, like their teeth are constricted.
Right.
And there's nothing I can do about that without going surgical, where if we had intervened when they were 6
Right.
or 7 years old, they wouldn't have that problem.
Right. And I think it comes down to
It's something my dad would have never considered.
right. And orthodontics, it's somewhat newer. Like, it started in the 1930s, 40s. So,
Yeah.
I mean, some of this stuff took a while to develop and see the outcomes of treatment that was done back in the 1900s, to see the results. And we're able to learn now, how we should be treating and really being proactive about all of this stuff. So that's why it's just so important that we can see kids younger, so that we can avoid some of these problems that come down the road with narrower
Right.
palates. So really, over the years, it's been interesting to see the changes between dental treatment, orthodontic treatment over the past couple of generations, just to see how far we've come. And at the end of the day, it's being able to use technology to make things more efficient for our patients, because their time matters a lot. And the more efficient that we can be to get great outcomes, that's better for everyone. Less appointments to the dentist and
especially
doctor.
with ortho, because you guys see your patients so much
Right.
more often than I do.
Right. So that's where it just comes down to proper treatment planning, diagnosing,
Yes.
and having a clear goal in mind of where we're trying to go.
Where's the outcome?
Right.
Yeah.
So that's, and that's where some of the newer technologies coming in to help us be more precise with bracket placement and all of this stuff, just to make treatment be more predictive so that we can have great outcomes with less appointments. So the goal is to usually have around 13, 14 appointments or so.
So when you're talking about technology and what we can do with prediction, like I dabble in ortho. I do quite a bit of clear aligners. There's a bunch of different companies. I know you do Angel,
right.
Invisalign. There's a bunch of others. But what's really nice about those programs is we can do outcome-based simulations.
Right.
Are you using that a lot?
Yeah, absolutely. So one of the nice things about having these simulations is you can predict how the teeth are going to lay in the patient's smile afterwards.
Yes.
And that's huge because, in the past, it's like you're just straightening teeth and you're not able to really see it in three-dimensional space on how it's going to look on the patient. Yeah. So really seeing the outcome beforehand and then being able to know what type of orthodontic movements we need to incorporate to get to that end result. That's something that's really, really big right now, and that can help just kind of make us focus on the outcome and have a specific goal in mind on what we need to get really nice outcomes.
Yeah. Are you doing CTs yet?
We don't. We do when we need them.
Okay.
So yeah.
Because the two big X-rays in orthodontics are your cephalometric, which is like a side view of the skull, right?
Right.
And then you've got your panoramic, which is that big thing that you step into and it spins around your head when you go to the dentist and it shows all the teeth at once. But you're using those X-rays to build predictability, where CTs are coming into things now.
Yeah,
so when do you use those?
We use them when we think that there is a problem that goes beyond just looking at the teeth. So if it's a skeletal problem, that's something where we would use a CT. I think in our office, we take a lot of X-rays. We take a lot of progress X-rays too. Mm-hmm. So doing a full CT on a lot of patients,
you wouldn't want to do that for progress reports.
Yeah, so we kind of pick and choose, and I think right now that's probably the best way to go as kind of the data's coming out on all that. But I do think that the CTs are giving us a lot of data that people are doing research on, and I think that's what's really driving some of these changes in our treatment planning, because we're able to see the outcomes and be able to see the skeletal change that orthodontists can make. And that's something that we didn't have in the past because we were dealing with 2D X-rays, where now we're looking at things in 3D. So, back in 1980s, 90s, it was, we didn't know.
10 years ago, they weren't using CTs.
Right. So back then, it's like you knew that we were straightening teeth. You thought that maybe it was having some skeletal change, but you couldn't quantify it. Where now, we can use 3D imaging, we can have really detailed data points to see the before and after and the impact that orthodontics is making. And so that's really what's driving a lot of the change in orthodontics.
Yeah, it's a big change in dentistry in general, I think. I would pretty much refuse to work without a CT machine these days.
Right.
Like, we catch pathologies that went missed for years in people's mouths, developmental cysts, radicular cysts that are impacting their overall health that you just simply can't see in a 2D image. It's like, for people's perspective, it's like looking at the side of a car and trying to figure out how the engine works.
Right.
Just improves the patient's overall care.
And then we can even take these 3D images and pair it up with
the 3D scans.
With scans and see right where the roots are going and making sure. So it's all about the patient experience and the predictability of treatment so that we can get good results with the least amount of appointments. And that's where all of this technology is really helping us.
That's a good point.
So
it's about predictability.
Right.
Not necessarily doing it better. It's better predictability.
Better predictability and more efficient outcomes that are great.
Right on.
Yeah.
Okay. So let's talk about the legacy aspect of things. So I came in and I took over my dad's practice pretty early. He got sick. I've told this story on other episodes, but carrying that forward and being an individual while still honoring like what my dad did. You know, your dad, I didn't know him until I got my DDS and started working, but I knew who Just Ortho was because the sticker was on everybody's bumper.
Right.
Yeah. Like, what are you doing to carry it forward right now?
So going back to the efficiency part of orthodontics, right? So, if you're just starting a practice from scratch, you don't really have systems in place, or maybe you loosely have systems in place to see the amount of patients that you're currently seeing. But over the years, as your practice builds up, you're going to have to build in more of these efficient programs into your office to make sure that these systems are running correctly for more patients. And so with having my dad be an orthodontist for 30 plus years, some of our systems are really dialed in, and that's something that's amazing. We can see a lot of patients. It's, again, more predictable outcomes,
Sure.
shorter treatment times, things like that. But we still have to build on that, right?
Yeah,
we have to be our individual person coming into the practice.
I almost found it a burden at times when I would run into a system that was so well established that we weren't willing to shift on it at all.
Yeah.
And that's frustrating, but it also shows that the culture was built that way. When I came into the practice, it was earning trust not just in the patient, but in the staff.
Right.
Like I think a lot of people think I walked in and inherited that trust.
Sure.
It wasn't like that for me. Like there was plenty of patients who were like, oh, your doctor's son, that's fine. And then I'd watch associates come in and that trust didn't necessarily transfer to them.
Right.
But I had to build the trust with a lot of patients.
Absolutely.
And my favorite example, and you'll probably relate to this because you're an airway-driven guy, is I've started asking patients if they snore or not because I can definitely see it on their teeth.
Right.
And you should wear a night guard. Why hasn't anyone told me that before? Your dad never said anything like that. And then you have to have this discussion of like, this wasn't a focus of dentistry.
Right.
We were still discovering things like, oh, you have generalized sensitivity and a lot of recession on your teeth. You're probably clenching and grinding.
Right.
Like,
yeah, and I think especially with orthodontics, how in the past there used to be a lot of extraction cases, right? That was like
I'm missing 4 teeth because of you guys.
Yeah, yep. And that shouldn't be the case. And we can pretty confidently say that if a patient comes in early, for the early phase 1 of treatment, if they have crowding issues, that we can create enough space for all of their permanent teeth to come in, and there's a very high chance that they won't have to ever have a tooth extracted.
Yeah.
Besides maybe wisdom teeth.
Sure. Wisdom teeth are useless. Yeah. But let's like clarify though too. Like my orthodontist didn't destroy my life because he had 4 teeth taken out of my mouth. But for some people it did cause complications.
Sure.
I lucked out. My palate didn't narrow. It's probably not ideal, but it didn't narrow as much as some people's did. But you have to like respect what your dad was doing. And I had to respect what my dad was doing, but also be willing to be like, have those conversations of things are changing. And you have a really, really powerful story that you had said at your big event the other day. Do you mind just giving us the cliff notes of that?
Yeah.
Because your dad's wasn't necessarily an airway guy.
He is, but he didn't really know what we were what the outcomes were.
The connection wasn't made.
Yeah. So I mean, I am really lucky that I came into a practice where he already is treating that way.
That's good.
It's just we're just starting now to make that connection. Yeah. And it's not just us; it's the whole orthodontic field
and dentistry.
Yeah, so I mean that's great that he was already treating this way, but I think now kind of looking at things in a different lens to see how orthodontic treatment can benefit these patients.
Can we specifically talk about your patient?
Sure.
The bedwetting thing?
Sure. So we had a patient come in last summer. They've been having bedwetting issues for like 4 years or so.
And they're not 4 years old. They were like 7.
They're 7 now. Yeah. So this has been going on, and to be honest, it's at the time when we first started treating her, I didn't really think about how much that could impact someone's life. But the more I was talking to the mom and just all of the all of the treatment that they have gone through and
Nothing had worked.
everything that they had been trying. Just really understanding how much of an impact that can have on a whole family, and especially, the young girl. So we went forward. I mean, we did our, initial, consultation, really delved deep into medical history, x-rays, all that stuff, scans. And she had a really narrow palate, and especially on the lower two, really, really narrow. She already had adenoids and tonsils taken out. So she had like everything else done, but her palate is still super small. So what we did is we expanded.
She couldn't breathe.
She was able to benefit quite a bit from orthodontic treatment at that age.
So she went through expansion.
Right.
You guys expanded her palate, and the bedwetting stopped.
Right.
That's a powerful, powerful story.
Right.
Like, there wasn't a dry eye except for my emotionless ass in that entire building, listening to the mom tell that story.
It's an amazing story, and when she tells it, it really shows the significance of what orthodontic treatment can do.
Yeah.
All of us were teary-eyed after that, because it's just, you get so caught up in what we're doing, and you just kind of get numb to it at some point, like the outcomes, and just seeing the impact that we can make beyond just straight teeth is super, super powerful.
So let's hit on expansion a little bit, because it's a bigger and bigger topic in dentistry. I was at the Spear Summit, and airway and breath, how the teeth impact breathing, the narrowness of the palate, because the roof of the mouth is the floor of the nose. So why would that have any impact on bedwetting?
So the roof of your mouth is the floor of the nose, which is correct. And if you expand, you can increase some of the nasal cavity volume. And that can obviously help some with their breathing through their nose. But the more important part is how the air is getting into the body. So usually we're breathing through our mouths, even if you're sleeping at night. If your airway is small through your mouth, you still have to get the same amount of air into your body.
Yeah.
And sometimes there's a discrepancy in kids because they're growing fast. Maybe their mouth and lungs aren't keeping up at the same rate, or there's a little bit of a discrepancy between their growth pattern, between their oral cavity versus how much air they need.
After listening to surgeons at that last conference, I'm convinced that 99% of human beings don't develop quite right.
Right. Yeah, and it's
to varying degrees, obviously.
Right. And I think that's part of it, is that as we're growing up as kids, you're just growing at different rates, different speeds. And if someone has a really narrow mouth at that age and they still need to get the same amount of oxygen into their body, what happens is the air that comes through their mouth, it has to come in faster because the airway is smaller. And I always make the connection between when you turn the shower on and the shower curtain comes in towards you. That's the increased velocity of the shower with the water coming down, and that sucks the curtain in. And that's the same thing that happens with kids, is when things are so narrow, they have to breathe harder to get that amount of air that they need to survive, and that's what collapses all of the tissue around them. And so at night, if this is happening, it's waking them up. It might not wake them up completely, but they're not able to sleep as fully as they should be.
There's a hormonal cascade.
Right, and then it can either their body can wake themselves up through bedwetting, or
so the body trying to wake the kid up to breathe.
Right, because it's a sympathetic response. They're choking. So that's what's going on. So that's the connection between all of it.
The non-conscious part of the brain is, I need to become conscious. I will wet the bed to wake up.
Right.
To start getting air.
Right.
Yeah.
Yeah. So that's really the easiest way to put it together. Yeah. And I know it's surprising, and I think we're just kind of really starting to realize the impact that orthodontics can have.
Yeah, we were talking about this on a different episode, that a physician friend of mine was like, a lot of my colleagues will kind of dismiss dentistry at times as a softer area of medicine, but breathing, eating, and drinking all go through the mouth. That's probably a
Right.
pretty important area.
Right. Yeah. Yeah, exactly.
Yeah.
And I went to a meeting and someone had mentioned that
Is this the meeting down in Costa Rica or wherever you?
this was out in California. It was about sleep dentistry and orthodontics mostly. But they were saying that MARPs, which are, it's
a way of expanding the palate.
yeah, in adults.
We're going to do a case soon here.
Yes. That is the most cited dental appliance in medical journals.
MARPI is.
Yeah.
That's crazy.
And so that just kind of shows
More than
where-
like mandibular advancement and things like
Yeah.
that. Okay.
Because that's where all the research is going into, is that it can have an impact on, breathing issues even in adults. And I think, having those treatments as an adult is probably...
It was way more brutal.
Yeah. But I think the impact can be bigger because you've been living your whole life, kind of with this constriction or different airway. And then now all of a sudden there's a change and people just experience a huge difference in how they're sleeping and breathing.
Well, and that leads to better mental health, better confidence, better overall health, just the improvement in quality of life drastically.
And so that's when we start looking at younger kids, that's where you start seeing these overlaps in behavioral conditions. So if they're not sleeping well at night, then they're restless in school, they're not learning correctly, and all of those things tie into their behavior at school.
Yeah.
And it's such a critical window when they're, 6, 7, 8 years old. Their learning has to be really good. They have to be sleeping really good. And so if that's impacted, that can have a huge impact on their whole life.
For sure. Not every kid who gets diagnosed with ADD, it's because of a constriction in their airway. There are plenty of us, myself included, that are just biochemically a little out of whack. But if I wasn't able to breathe or sleep at night and I've just been getting over a cold, my day's awful.
Right. Yeah.
I couldn't imagine going through it every night.
Right. And then imagine that as a young kid growing.
Yeah, it sucks.
And that can have an impact on how their brain's developing. And I know there's a lot of research going into this. And, I think some of it can be quantified now because we have those 3D x-rays.
Yeah, for sure. Let's move on to go ahead and talk about the business side of things, man. So I got out of dental school and joined my dad's practice. I invested heavily in technology. I was fortunate that my dad was a big gadget guy. He already had a 3D scanner. They weren't using enough. He had a CBCT. Again, they weren't using it enough. But I had those tools involved.
Right.
And I upgraded our scanners and systems that we had, bought 3D printers. One thing that I learned about myself when I started practicing was that I was never going to be satisfied with where I was, that I always wanted to continue learning. And I've invested a lot of time and money into continuing education and becoming familiar with my specialists in the area to create really great dentistry. And I learned that I need to balance that with life. But what have you learned about yourself? And because it's probably been a bit of an adventure taking over for Dad.
Yeah, I think it's definitely just staying really organized with things, and again, just relying on the systems in place because it's just key, and that's how we're able to grow. I'm really into working out and have different hobbies and stuff like that. So we went skiing, just doing fun stuff like that. I love it. So having a good work-life balance is good as well.
You grew up in Manitowoc, which is a little north of here, about 20 minutes. It's actually where I was born. You moved back with your girlfriend at the time.
Right.
Why'd you settle in Sheboygan instead of Manitowoc?
Yeah, well, we both grew up in Manitowoc.
Right.
So I think we just wanted to try something a little different. Yeah.
Sheboygan's so different.
It's so different. A little bit. A couple more people. We spent all of our lives growing up in Manitowoc, and we wanted something a little bit different. And living in Manitowoc, you don't really come down to Sheboygan. It's either like you're going up to Green Bay or going down to Milwaukee for things. So we didn't
I would say the same thing is true if you live in Sheboygan.
Right.
You're not going to Manitowoc.
Right, you're not going to Manitowoc. So I think just, knowing that we could still be close to family, but kind of living
separate.
And yeah, I think that was kind of the main driver behind it, and we love it.
So you're planning your wedding right now,
Right.
which is awesome.
Yeah.
Congratulations.
Yeah, thank
Des and
you.
I are super excited for you too.
Thank you.
What's that been like, trying to balance that personal life of planning a wedding with both of you guys working full time? And
Right.
both of you work in dentistry too.
Right.
And not in the same building.
No.
So it's not like you can sit down at lunch and plan your wedding.
No, that's been mostly in off hours, right? Some planning. But yeah, I mean, what was nice is we have a plan. We had a plan right away on where our venue is going to be. So that made things quite a bit easier because we're like, okay, we have that nailed down. Then what's the next thing?
Sure.
Looking for, food and photographers, things like that, and just kind of chipping away at those things. And we were able to do that kind of straight from the start.
Good.
Where I know, if you're looking for a venue for a while, that can kind of hold things up because you might have to set your date based on that venue. So that really helped us out quite a bit. So I'd say we've been on top of it so far.
Right on.
But it's going good.
When you first graduated and I went to the Just Orthodontist event, it was the first time I went actually.
Yeah.
And you're up and everyone's introducing you and you're yeah, Ethan skied in the X Games, no big deal. I was like, okay, I need to be friends with this dude. Tell me, what did you do in skiing, man? I think that's one of the coolest things.
Right.
I was in a metal band. That's the thing I did.
Right.
But you were flying 50 feet into the air with two
Right.
pieces of wood strapped to your feet.
Yeah. I mean, yeah, my skiing background is kind of interesting.
What kind of skiing were you doing? You weren't just going down the hill?
So I think a lot of my skiing kind of stemmed off of when I was really young and my brother was into skateboarding and I was into rollerblading,
Same.
Kind of trick rollerblading,
Yeah.
grinding rails, stuff like that. And then my parents skied pretty often too, so we would go on ski trips with them. And I started, kind of relaying what I knew from rollerblading into skiing, which was a lot of the grinding rails, jumps.
Were you hitting jumps right away?
Not right away, no.
Okay.
But I really didn't start skiing a lot until I was 10 or so. And then we would go up to Granite Peak on Saturday, come home, drive back up there on Sunday. It was a lot of driving. But,
You had a YouTube channel for it, didn't you?
Oh, yeah. My brother started a whole video company. And, if I go skiing, even to this day, people still recognize us. But, yeah, so then we would just ski a lot. And like I was saying, I just loved it because you could push yourself, kind of go at your own pace, but it was something that you could set goals for yourself. And so we were just really a filming company, and this was right when YouTube was first starting. I mean, this was 2010, 2011. And so we had YouTube channels, and we were making ski videos, and they were getting a lot of views and attention.
Were they monetized?
But that kind of evolved into doing some more competitions because there's different series. So there's the Midwest Best. That's a series that's in the Midwest here, and you compete at different ski hills. And I was doing slope style, which is jumps and rails. Mm-hmm. And so you would compete at all these competitions, and you would rack up points. And then by the end of the year, they would have a nationals competition. So it's called the USASA, which is kind of, there's some skiers that come out of it that, are pros. Mm-hmm. But I went to the nationals 3 different times. 2 of them were on the X Games course, and then one of them was at Copper Mountain.
Nice.
And so that was kind of my later years of skiing, because when you're into filming, that's kind of separate from being in competitions. Because filming, you're just out there trying to get different shots, and you're maybe trying to land a once in a 10 or 15 try trick just to get it on film. Where skiing in competitions, you're trying to be consistent.
I think that relates to a lot of things in life. I think we use this metaphor too of watching a skateboarder do the same try the same trick at the park over and over and over, getting up again and again. And that's dental school.
Right.
but I think your competitive nature probably helped you get through ortho programs because they are highly competitive.
Right. Yeah, and there was like for the filming aspect, there was this trick that I was trying the whole season.
Yeah.
Every run I would hit the same rail and try it, and I got it once, and we got it on film, and we submitted. I don't even know what you would call it. There's a kink rail, so it was a double kink, and I did a switch up to a 1 foot slide on the last down part to a 270 off.
Okay.
And at that time, I hadn't seen anyone do that before.
Yeah.
And we submitted it into a best trick competition, and it was one of the finalists.
That's awesome.
It was cool it was a cool time to be a skier because, again, that sport at the time, it was progressing.
People weren't doing 1080s.
Right. Things were progressing. Now it's to a point where it's all like futuristic, like it's crazy.
So many times.
And so I'm really fortunate to have experienced that moment in skiing history, just where we would go out there, have fun, film, make videos.
Yeah.
That was a really cool time to be a skier.
Oh man. Let's talk about like how dentists and orthodontists interact and work together. I think we've hit on that a little bit, but for me, the biggest challenge whenever I'm looking at a case of somebody who has a lot of problems with their teeth is usually they're missing multiple teeth and teeth have moved into the wrong place or they just never erupted into the right place. So for you and me to communicate is we have to mock up that final positioning early on.
Right.
How are you supposed to know where to put the teeth?
Right.
So it's not just about me sending kids to you because adult orthodontics are becoming more and more prevalent.
Right. And so, it's important because a lot of like what you do is a lot of implants and more permanent things.
Right.
So
I always tell a patient, like before we even do the implant, I'm like, are you ever planning on straightening your teeth? Because if it's even in your mind.
Right.
As soon as I put that implant in, it either needs to come out or we have to move everything in reference to it.
Right. Yeah. So that's something that we have to really keep in mind as well.
Would that be a message that you would give to general dentists is to notify patients about that?
Yeah. Just to, because if there is, any inkling that they want,
I don't care how old they are. I've had patients in Invisalign in their 70s.
Right. Yeah. Same. And it's amazing the outcomes that you can get, at any age. So it's really important when we're doing work like that to make sure that we have a game plan together to make sure that the outcome is, again, good for the patient's overall health.
So if you're looking for a dentist or even an orthodontist to work with to like improve your smile, it's really important that you make sure that they have a great working relationship with either their specialist or their general practitioner.
Right.
Yeah. Because those two people, they need to be in sync with what they want that final outcome to be. Because the worst feeling ever, and I've had to deal with it more than once, is when I get a kid who comes in and they're missing one of their teeth congenitally, usually the lateral, as we know, and they have not made enough space for that tooth, and I have to tell the patient, there's nothing I can do for you unless you go back to the orthodontist and get your braces put back on.
Right.
And when they're 2 weeks of being out of their braces, and I tell them that either we don't do anything or you put your braces back. Yeah. So that communication has to be super important.
Yeah.
And I'm fortunate that I have you and one of the other, Dr. Meinhardt in the area, that we have awesome communication back and forth.
Right. Yeah, and I think that's what helps with being able to scan patients as well. And
you don't even have to send them to me anymore. If you scan them and send me that image, I can figure it out.
Right. Yeah. So, just the communication and again, the technology is just making it simpler and simpler for us. And then that just kind of dials us all in and keeps us on the same page. So, yeah, definitely sometimes those missing teeth, if we need to make enough space because implants are always kind of deceiving on, especially for laterals on how small they are.
Yeah. Also knowing each other's limitations. Like I'm not an orthodontist. I do some mild to moderate cases on Invisalign, but like it's important for me to understand how teeth move. And it's also important for you to know how I can actually, if I can or cannot restore them. Like space is at a premium when it comes to the mouth. If there's not enough space, we're not doing anything.
Right. Yeah, exactly. And that has helped me quite a bit because of how much I just loved dentistry and restorative when I was in dental school.
Yeah.
Just really like it. I don't want to abandon it.
Yeah.
I think it's all part of it. So yeah, I really love that, doing full mouth cases, and
They're super fun, and it's like a chance to like both of us show off what a case came to fruition. And sometimes we get the periodontal surgeon involved with cases, especially with expansion. And again, you and I are fortunate to be in a community where the competition, there's plenty of patients to go around.
Right.
We don't have to compete with each other.
Right.
And the same thing with me and Dr. Hoagie, the periodontist in town. If I place an implant, it doesn't bother him any because there's still plenty for him to do.
Right.
But also, him and I have the relationship that if I have an issue with an implant or I need his help on a case, we're like synced up with where we need to be. And when it comes to these expansion cases, we need him synced up with both of us.
Right. Yeah, absolutely. So again, just really optimizing patient outcomes by working together. That's really, what we need to be focused on. And I think we do a really good job of that here. And that's something that, down the road, I think that's going to be more beneficial for dentistry as a whole, as everyone working together.
If you could give one piece of advice to a kid, a student about to graduate dental school, so whether they're going into specialties or not, like what would it be?
From dental school, I would say right away, try to find someone to be a good mentor for you. Yeah. Because I feel like those years are critical in learning, because you just came out of school and you don't have any bad habits or anything like that. Hopefully. But yeah, just having that good first mentor to really show you how dentistry's done.
Was that mentor for you, your dad?
Yeah, definitely. But also, everyone at Marquette too, like there's a lot of the faculty there that I still talk to. And I think that's what's important, because I was able to learn orthodontics from, different faculty than my dad had when he was in school. So it's trying to bring all of these ideas together so that we can really optimize our experience at Just Orthodontics, so that it can be a good outcome. So that would be my advice for a younger doc, is to really find someone.
I would agree. I had a lot of mentors that I relied on. My dad, I relied on from like a business perspective, like how are we running this up until now? I don't do things exactly like my father did, but there's a lot of overlap. You could also learn from a mentor how not to do things. Like if they're doing one way and you're like, man, that doesn't make sense. It gives you the initiative to go and look for things. You don't need to be a carbon copy of your mentor.
Right.
What's one misconception that people seem to have about orthodontics? Patient-wise.
Yeah. I think right now the misconception is that in the past orthodontists were treating one way, and now we're still treating how we were, 20, 30, 40 years ago.
You guys aren't using headgears then.
Things are a lot different now, and maybe the parent experience, 30 years ago isn't what it is these days. So the braces experience is a lot better. It's more efficient, with better outcomes.
You're not cranking on roots like you used to.
Right. So the overall experience has gotten a lot better. And especially when we're treating kids younger, then that really helps us create the foundation to make things even easier.
Yeah, it's such an important time of life. Like, I'm not a pediatric dentist. Again, we're fortunate in this community to have 3 excellent pediatric dentists.
Yeah, we are.
And when I have a kid in the chair that I know I cannot deliver a good experience to, and I know that's going to impact, it's time for me to step away and let the pediatric dentist take charge. because I have too many patients who come in and they have an idea of what dentistry is going to be like in their mouth, and they're fearful. They become argumentative. It becomes more difficult. I don't want that kid coming into my chair in 15 years and having the same biases.
Right.
Because dentistry now, I'm not going to say that every experience you're going to have at a dental office is going to be 100% positive.
Right.
But, you know, our local anesthetics are way better than they used to be.
Right.
Electric handpieces have made it so we can be way more precise in our preparation of the teeth.
Sure.
We can do a lot that we haven't been able to do. Have you heard of Curodont yet?
I believe so.
Okay.
It's supposed to help seal teeth.
Yeah, reverse caries.
Sure.
So if Curodont wants to sponsor this podcast, you can hit me up at Taylor Drive Dental Care. One of the fastest growing products on the market, and it can reverse enamel caries. For those who don't know, we don't really call something a cavity until it's all the way through the outer shell of your tooth called the enamel. Once it hits that inner layer called the dentin, that's what we would call a cavity, because that's when the decay has permeated the hard shell of your tooth to the soft shell. Mm-hmm. If it wasn't, we can see it on x-rays, and if it's not going all the way through, we would watch that lesion.
Right.
I don't know what we were watching it to do, but you ever heard the doctor say they're going to watch it? It means that it's not a cavity yet, and we're hoping it doesn't become one.
Yeah.
Curodont can reverse some of those, and we've been working with it a lot. And
there's going to be a lot with peptides coming out too.
Yeah, I've been hearing more about that.
I think that's going to be maybe a game changer.
Yeah.
Because I know, some of the growth factors and all that can probably has some sort of impact on the perio, I would assume. So,
which is the gum tissue and bone around the teeth. Yeah.
Right. So I could see, down the line.
Even be able to improve saliva.
Yeah.
Yeah.
Yeah, maybe. But technology keeps progressing, and I think it's our job to keep utilizing it to help our patient experience.
I saw a really cool article. I mean, you probably heard about the testing they're doing on regrowing teeth.
Sure.
They're doing in Korea, I think.
Yeah.
But that's way in the future.
Yeah,
that's going to be so expensive to do.
Right.
Like anyone who thinks that they can lose their teeth because they can regrow them, I'm sorry, that technology is probably 25, 40 years away. But it's changing, and the experience is going to be different.
Right. Yeah.
But in dentistry, what we have to make sure is that personal touch doesn't go away.
Right.
That we don't become a conveyor belt of a robot and an AI assistant doing all of our work.
Right.
You and I have both explored AI quite a bit. Our impressions and our experience and making the patient feel comfortable, that's something AI cannot do.
No. And it won't. And especially in dentistry where, there is a lot of communication between the doctor and patient, making them feel welcome to our practice. That's so important. And especially when you're talking about dental anxiety and how we can help with that, and especially with younger kids. I mean, that's key, is to really, set the stage that going to the dentist is okay.
It's okay.
It's okay.
Yeah.
And
and we're here to make you feel better. We're not here to make you feel pain.
Right. And I also think that orthodontics can play a role in that as well, because although we're not dentists, they think that we are.
Yeah.
And they generally have a good experience at the orthodontist, which I think can kind of help set that stage. It has to help kids as well, just feeling more comfortable with going to the dentist.
I would agree. Because we are working in a very intimate area, and anyone is going to feel slightly vulnerable. Like the comparisons would be your proctologist, a urologist, or an OBG.
Right.
Those are the only other ones that you're as vulnerable as probably when you're in the dentist chair. But, we have to accept that the patient is in a vulnerable position. They're going to feel vulnerable, and we have to be empathetic to that.
Right. Absolutely.
Right on, man. Well, let's wrap it up here. This was really fun. We'll be able to have more conversations in the future, probably. Do you have Instagram, social media handles, anything like that you want to share with people?
Sure.
And remind us where you're practicing again.
Sure. So you can reach our practice Instagram at Just Ortho, and then we're Just Orthodontics on Facebook. We have a location in Manitowoc, Sheboygan, and Chilton coming in the future.
Right on, man.
Yeah.
All right. Well, thanks, Ethan, for joining us. This has been another episode of the Death Before Decay podcast, and I hope you all have a great day. Thanks.